Let's see now the urine. Urine basically is water. 95% of urine is made out of water, and there are around 5% of solutes. What are these solutes? Mainly nitrogenous solutes like urea, uric acid, and creatinine. Plus, there are plenty of other small solutes, other ions like sodium, potassium, phosphate, sulfate, calcium, magnesium, and bicarbonate, plus plenty others. Urine would appear a little bit yellowish due to a dye called urichrome dye, and the color of the urine will change with the hydration. As far as we get dehydrated, there is higher levels of the yellow color within the urine. Usually it should not give any smell, and it's clear, not cloudy, and of course there should not be any blood. The pH of the urine is around 6, but it can change because of the diet of the body. Now, there are some conditions related to urine, and especially these when we have abnormally high concentration of any of the components of the urine, or if there are other components that should not be there, like blood proteins or white blood cells or bile pigments. All of these might indicate a disease or a problem in the kidneys. For example, we have a condition called oliguria. This is in case of severe dehydration or renal disease. There is the polyuria. This is the excessive urine production, and this might be due to diabetes mellitus or diabetes insipidus. There is the hematuria. This is the presence of red blood cells in the urine. There is the polyuria, which is the presence of white blood cells in the urine. The urine, based on the concentrations of these solutes, we can have either diluted or concentrated urine. And to understand diluted or concentrated, we can think of 2 cups of salt and water. So we have salt and we have water in these cups. I have 2 situations. Either I will have more water in the cup and less salt, only few salt, and in this case it will be diluted water or salty water or salt water, or I will have more salt and less water. So this should appear like this. All the salt is down, and this is the level of water. So here I have less water, which would lead to high salt concentration. So in this case, we have concentrated urine. So concentrated urine is urine with less water. We can think of it like this. Whereas diluted is urine with more water. Usually, either cases is not a problem unless there is underlying condition, especially related to dehydration or related, for example, in the diabetes. So water intake and respiration would influence the urine output. It will influence if we have diluted or concentrated urine. Under normal condition, the kidneys will produce around 1 to 2 liters of urine every day, but some drinks and foods would either increase or decrease that urine output. Alcohol, for example, will increase the urine output, where fibers would reduce it, and so on. Now, the osmolality, a term that we need to be aware of is the osmolality, which I kind of explained here. Osmolality refers to the concentration of the solutes in a fluid. So here I have less salt, so this is low osmolality, whereas here I have high salt or more salt, I have high osmolality. And that level of osmolality, especially in the extracellular fluid, would influence the urine output, and we will see how. But it's not only the extracellular fluid that would influence the urine output, also hormones would influence the urine output, like ADH will cause concentrated urine, whereas aldosterone would cause diluted urine. Remember, this is going to block urine formation. And in case of severe dehydration, we will see huge absorption of water. So how does it happen? In order to have concentrated urine, we can think of a situation. There is an activity in a hot day, and there is less water intake. There is respiration of water, there is sweating, but there is no water intake. So in this case, we have less water but high solutes in the blood, right? And in the blood or in the extracellular fluid, that's the situation. We have high osmolality. So who is going to detect this? The osmoreceptors would check the concentration of the ions, mainly sodium, and base, if they feel that the concentration of the sodium is a little bit high, they will release ADH. So ADH is released, it will target the collecting ducts, and as we saw in the previous video, it will ask these cells to display more of aquaporin, the water transporter or the water channel protein. So the water now can be captured from the collecting duct and released into the extracellular fluid. So here we will have water reabsorption is increased, and this would lead to small urine volume of concentrated urine. Small urine volume because we absorb most of the water, and that urine in this case will be concentrated. So this is during dehydration. During overhydration, like for example it's cold and the subject is drinking water, so here we will have huge volume of water or high water volume, and this will cause less solute concentration. So we will have low osmolality. The osmolality will be decreased. The same situation, the osmoreceptors in the hypothalamus would detect the low osmolality, and this will cease the production of ADH. So there is less number of aquaporins in the collecting ducts, which means to release more water into the urine, and we will have large urine volume, and that urine is diluted. So that's how we have the two types of urine, either diluted or concentrated, based on the osmolality of the plasma. Now the rest of the organs of the urinary system, we have the ureters. These are going to transport urine toward the urinary bladder, and the inner mucosa are lined with transitional epithelium. If you remember, this is something we saw in AB1. These will change their shape to adapt the size changes, and they will penetrate, or they will go into the urinary bladder. And here we have like a one-way valve that would prevent the backflow of the urine up to the ureter. This is a transverse section of the ureter, and you can see the lumen surrounded by smooth muscle. These smooth muscles will contract to create something like peristalsis movement that would keep moving the urine forward, even without the aid of gravity. Then we have the urinary bladder, which is a kind of a temporary storage of urine. This is retroperitoneal, so it's out of the peritoneum. In the males, it's posterior to the pubic bone. In females, it's anterior to the uterus. It has opening for ureters and for the urethra. And we can think of it, it has also three layers: the mucosa, that's transitional epithelia. Then there is a muscular layer. Then there is the fibrous adventitia, which is like a kind of a protective layer of the urinary bladder. That's all for this chapter. I hope it's clear. Let me know if you have any question.